Good afternoon, everyone. Thank you for joining us on our webinar today for some very insightful discussion around COVID-19 and how that is affecting the food industry. Thank you so much for your very enthusiastic response to the poll questions. I think they really reflect what we're seeing in industry, what we're seeing in our own lives, of concerns around how do we avoid COVID, how do we respond to it, how do we protect ourselves, how do we protect our families. As we look at the second poll question that some of you have already answered, those concerns are around what do we see that's not being done well. Forgetting to wash our hands, 33% response there. Not touching our face. We're certainly rethinking how often we do those things and when we do them. Not maintaining the physical separation, that 6-foot distance, certainly challenges and things that that are new to us. So these things will very naturally have an effect on the supply chain and the environment in which food is manufactured, moving forward and now. We have a great panel of presenters for you today. They will be talking about a survey that we recently sent to our NSF client base around supply chain food safety, QAI organic, consumer values verified customers. And we surveyed both large and small processors. We had greater than 300 responses. And this webinar will reflect what we learned from that survey, and will walk us through, each presenter will walk us through some guidelines and some best practices moving forward. And we're excited to share that information. NSF just last year celebrated their 75th anniversary. And we were founded then 75 years ago as a public health company. And we are uniquely positioned now to support the food industry and consumers through this process of our new normal, living with COVID-19 and the impacts from that. Our agenda today will cover about 35 minutes of presentation, again, based on the results of those survey questions. And those of you who completed our survey and responded that you would like results of that survey, we will provide those back to you. So we will talk about the survey a bit and a quick summary of that. Then some updates around best practices with COVID-19, certification guidelines, so the response from the GFSI benchmark certification programs and the changes that have come there, organic food and product claims certification, and then cleaners and hand sanitizers in food facilities. And one of the key things we saw in the survey was that sites were having a difficult time getting sanitizers, gloves, and hand sanitizers, gloves, and sometimes sanitizer for cleaning the line. We have reserved 15 to 20 minutes for questions, and we will utilize the chat box, the questions for that. And we will share questions that are most relevant to the groups. And if we don't answer your question, we will work to get that answer to you after the webinar. So we are excited to support the food industry through this process. If you have a contact within NSF, we will show contacts, of course, at the end of the presentation, but reach out to us. You can find us online, and we are happy to support you. We offer many services. Those of you on the call are probably familiar with us, but we are a standards-based company. We work with governments and agencies to write standards. We perform testing, certification of product and equipment, and chemicals used in food, auditing to both GFSI and the second party standards and our own NSF supplier assurance standards. We offer consulting services across a broad range in the supply chain and in retail food service. And then, of course, our training group providing some very innovative online training programs at the moment, since we're all not traveling. So as I mentioned earlier, the survey conducted went to a broad swath of clients. And this is a general summary. 90% of the respondents said COVID-19 has impacted their business. Employee safety was one of the top reported priorities as they are trying to maintain or increase production and respond to those physical distancing requirements. Do we have enough soap and hand sanitizer? Do we have enough PPE? There have been some real challenges. And then, of course, those food safety challenges. When you're running the facility with fewer people, there are always challenges and stressors on making sure we maintain those food safety programs. And if we're increasing production, then that shortens the time for sanitation and other changeover activities. So this makes a lot of sense considering the stress that the food manufacturing industry is under right now. So at this time, I would like to introduce Paul Medeiros, who will be talking about the nature of the COVID-19 virus and some updates and best practices.
Hello, everybody. Of course, I'm sure you guys all know me very well. Once I'm given the opportunity to speak, I don't stop. So keeping me muted for an extra minute, I think, was probably helpful. So at any rate, I'm very happy to present. Thank you. We're going to start by talking a little bit about the characteristics of SARS-CoV-2, the virus that causes COVID-19. It is spread by people with and without symptoms. And what's interesting about that is that it is fairly infectious. The transmission rate is often referred to as the R0 factor, and it's between 2 and 2.5 generally. And that means that every infected person can infect between 2 and 2.5 others. What's interesting, though, is if you look at countries like New Zealand, they are actually starting to reopen now. They put in some very aggressive measures. Their R0, or transmission rate, was less than 1. So to me, that speaks to how, with very aggressive measures, whether you are a country, a city, a state, a province, or even a food manufacturing facility, you can reduce the likelihood of transmission. Again, though very infectious, we have over 2.6 million cases globally. Those are the ones who've tested positive, and I'll leave it up to you to imagine what that number really could be, because again, it depends on who you ask, but it is suspected to be much larger than that. And of course, unfortunately, 185,000 deaths globally. In the US, 844 cases as of this morning's count, and in Canada, 42,000 cases. So it is transmitted between people by air, specifically via respiratory droplets, and they don't travel very far. They travel just under 6 feet. So that definitely helps, but they do travel. Again, no evidence of food transmission at this point. There is some theoretical possibility of transmission through surfaces. So in theory, it could be transmitted if a food handler somehow infected a hamburger as it was being passed on to you. But in terms of it being transmitted through the digestive tract, still being studied, but no evidence at this point. It's a virus, so it needs a living cell to reproduce. It can survive outside a host, but not very well. It actually is pretty easy to destroy, fortunately. The time that it lives outside the body obviously will depend on the kind of surface. So some surfaces such as plastic, stainless steel. There have been tests or studies that indicate it'll survive up to 3 days on those. Less if it's a softer, more porous cloth type surface. There have been findings of non-viable elements of the virus after up to 16 days. But again, that causes a lot of controversy because you hear, oh my gosh, it survives for 16 days. Well, actually, no, it's not in a viable form after 16 days. The viable form of the virus in those studies indicate that we got up to about 3 days. Then the final point here, before I move on to the next slide, is around good personal hygiene. Yeah, that is one of the primary means of protecting yourself or preventing transmission. Of course, the best route is really physical distancing. Get into a few of those details in my next slide. So what's working? And we have to recognize when we think about what's working in terms of prevention and control, it is definitely tougher on some sorts of food manufacturing settings than others. So clearly what's been in the news a lot on both sides of the border have been the meat plants closing. When you look at those scenarios, you really have employees who are literally elbow to elbow. Those types of scenarios make it very, very challenging to implement these controls. So what sort of controls? Well, we look at these broad categories, and I'm not going to do too deep of a dive into these because I think most of these are known. But when it comes to the personnel controls, really, your people are the backbone, but also the Achilles heel of your programs. In the polling question, I believe 33% of the respondents indicated that hand washing was one of the areas that they saw least or perhaps the biggest challenges with. And hand washing, quite frankly, is one of the best ways you can prevent yourself from contracting it, because if you have it on your hands, virus on your hands, and you inadvertently scratch your eyes, rub your nose, or start touching other things, you present an opportunity for spread. We look at some of these other controls around PPE. I'll talk a little bit about masks in my next slide. Movement and flow, obviously quite critical around that. Best practices, and again, these might sound pretty aggressive to some people, but they may not be aggressive enough for others. One best practice is to actually introduce a 30-minute break in between shifts. That way you've got a chance to disinfect those common touch points in between. It also makes sure that each shift needs to be viewed as a pod or as a bubble. Technically they're referred to as cohorts, and cohorting means you don't let your cohorts intermingle with each other. So if you've got your shifts, you really shouldn't let people be switching from one shift to another. The idea of the shift is that if somebody in that shift does become sick, then they've limited their spread just to that shift. So worst case scenario, if you then have to send an entire shift home, then it is just that shift. You are left then with other shifts who can continue to keep your operations working. So those are a few things. Again, around personnel, we've been hearing a little bit more about temperature. So should you take temperatures of your teams or not? That is becoming more and more of a best practice, and actually in some cases even a requirement. Physical distancing, get into that a little bit. I really like the idea of engineering controls, recognizing that people are human. There's this one concept, and it's written there. It's called pokuryoke, Japanese term for error proofing. In other words, you can ask your teams to physically separate, but are they going to? In a lunchroom, will people actually keep 6 feet apart, or do you need to do something like not give them a choice by removing the chairs so that there are only enough chairs to sit, by putting in shields, separating people? Again, depending on your table is set up, if you have somebody sitting across from another person, even if they're 6 feet away from the person to their left, doesn't matter. They're just spitting distance from the person in front of them. So orienting the chairs so they're just on one side of the table. So things along those lines. We talked about digital controls as well. Obviously, you need to continue to monitor your programs and your QC. If you've got paper in your facility still, that's a problem. Papers and pens are common touch points. If you have individual, even iPads, where individual people have their own iPad because their QC programs have been digitized, that's one way of controlling it. If you don't have individual people with their own iPads, if you're sharing iPads, that's a common touch point, and it needs to be disinfected in between. Operational controls, this is where things can get a little tricky, because if you are a elbow-to-elbow facility and the only way of creating space is to slow down, is to reduce throughput, that is often a tough decision that needs to be made by companies. What some companies have been doing is reducing the number of products they're preparing. So they might have 200 different products they typically prepare. They've reduced it down, or manufacture, they've reduced it down to 2 or 3, or along those lines. Again, if you've got reduced SKUs, it just makes it easier to manage and to control, less shift change or less product change, less manipulation of the equipment of the packaging, less opportunities for people to contaminate each other, contaminate surfaces. And I mentioned employee shift change management earlier. One thing that I do want to mention as well around that is keeping your pods separate, 30-minute distance, or the separation, which I talked about. Another thing is your entrance points. You should consider having only one entrance. You will still have multiple exits, but if you have only one entrance being used, that enables you to screen your employees coming in. Supply chain management, again, this is making sure that you protect your supply chains from disruptions. So looking at alternate suppliers now, looking at how you handle delivery and shipping. So what kind of access would the drivers have to your facility? Are there common touch points around paper, or have you gone paperless with that as well, which can be tough. Legitimate assessments. So in other words, if you want to see how well your supply chain or your co-manufacturers are implementing COVID-19 controls, you don't send them a questionnaire asking, hey, how well are your controls? You actually have to ask specific questions. In the absence of in-person auditors, consider some remote audits as well. Again, we cannot make assumptions. And often a supplier might feel, no, I've got it. I've got controls, I'm good. But you as a purchaser, if you aren't comfortable with their controls, then you have to speak up, because it could be a disruption to your own ability to produce if a key ingredient supplier can't supply you with products. Communication is key, and more so where employees are actually scared to come into work. Now's the time not just to convince them that you've got things under control, but even to convince their families. I know of employees who are telling me that the only reason they go into work is because their families are letting them go into work. And so again, many people, customers, employees, families need to be convinced, and there are many ways of doing that. Again, the two-way communication is critical. One thing that NSF has actually done, and we've delivered this for free, is provided questions that it's 7 questions that any company can ask their employees through an online survey that can give you as a management team a sense as to whether or not the employees get it, that they understand the risk, that they understand your programs and protocols, that they are willing to follow them because it makes sense. I mean, if the result of those surveys indicate that your employees don't get it, then it shows that they're not necessarily being the backbone, they're going to be the Achilles heel, and then you're able to actually make some improvements, either in how you communicate or how you implement your programs. And the last thing you want to do as well is put in programs in place, but then whether it's internal mask use, but then you run out of masks or you run out of hand sanitizer. So there can't be a disconnect there, because then you lose credibility. Then sanitation, routine sanitation, as you currently do as per your food safety program, is fine, because SARS-CoV-2 isn't a foodborne pathogen. But you need to have disinfecting programs. standard disinfecting of all the common touch points, and then intensified should one of your employees test positive. So I mentioned a couple of things that I was going to dive into a little deeper. Face coverings to cover or not to cover, and both in Canada and the US and elsewhere around the world, we are seeing the use of masks, absolutely. And non-surgical masks, not to protect the wearer, clearly, but it's to protect somebody who is an asymptomatic carrier, doesn't know it, from spreading it to surfaces or to other employees. So in a nutshell, that is why more and more masks are being used. Some general concerns around masks that, yes, they can give you a false sense of security, and they do not replace distance. So you still need to maintain all the other controls. But masks are one, it's the hurdle effect, right? So just one more hurdle you're putting in place. And so that's why they're now becoming pretty commonplace in food manufacturing and beyond. Of course, if they're not handled properly, they can present some food safety risks. Homemade masks in particular, if produced inappropriately or made improperly, can become a foreign material risk as well. So you want to manage that. The last slide I'll talk about is what to do when an employee tests positive. The CDC about a week and a half ago did release some new guidance on this. So it's not necessarily a closure sentence. If one of your employees tests positive, you don't necessarily need to close. That's good. Always follow public health guidance, of course. But there are some things that you can do. Now, if there's a positive employee, and that employee obviously is excluded from work, then you need to do a risk assessment. So basically, you need to understand who in my workforce was within close contact with that employee within 2 days of them exhibiting symptoms. Now, again, we obviously still need to remember that there can be asymptomatic spread as well, but now we're talking, symptomatic spread. So that's in this particular case. And those employees who are within close contact in 48 hours, the recommendation is that they can continue to work if they are asymptomatic, number one. Second, if you pre-screen them before they come into work, and that includes taking their temperature. And if they have a fever, then they don't work. You're also monitoring them throughout the day. So if they exhibit any symptoms, then immediately they are excluded from work. You should have an isolation area in your site they can go to, and if they cannot leave right away, they would wear masks and obviously keep them separate as well from the other employees. So this is relatively new, so that's why we wanted to highlight it here with you as well. And that, in more of a nutshell, represents some best practices around COVID-19.
So hi everyone, and thanks again for joining us today. I'm the scheme manager for IFS, and I'll talk a little bit about how GFSI and the certification program owners like BRCGS, IFS, SQF are handling this unprecedented and ongoing situation. So this is a new and challenging reality for all of us. And since this started, we've been receiving updates from GFSI and the certification program owners almost on a daily basis as this crisis unfolds. So talking a little bit about GFSI position, their position is that the certification program owners, like I said, BRCGS, SQF, IFS, they can allow or not allow a certification extension. So to be able to extend if the certification program owners are allowed to extend a certificate, the CB has to do a risk assessment, and then following the guidelines from the certification program owners and the IAF IV3 document. So the goal for this risk assessment is to confirm that the certified organization is equipped to maintain practices and processes covered by their certificate. So based on that, the certification can understand the risk level to extending the certificate. So I will talk a little bit about how each certification program owner are handling this situation on the next slides. So let's start with IFS. So IFS, their position remains the same since the beginning of this crisis. So they're not granting an extension for the certificate. So if a full on-site audit doesn't happen, the certificate will expire. However, IFS has developed some tools that we can offer to our clients during this crisis. And I'm gonna talk about a little bit about all those 3 tools that they develop. So the first one is a box into the IFS database that shows when an audit cannot be performed due to the coronavirus crisis. So this can be done by the certification body when requested by the company. So the ticking the box does not mean that the company has stopped acting according to the standards requirements, but that means that the audit could not take place and the certificate lapses. So this is visible for the company's business partners, so they can see that the company was impacted by the COVID-19 crisis and could not perform their audit. The second option, the second tool that IFS developed is the remote surveillance check. So this is a one-day announced assessment that is done remotely. And this check offers the IFS certified companies the chance to demonstrate that their supporting procedures and management processes are maintained during these challenging times. The outcome of this check is a letter of compliance issued by us. And also we upload this document into the IFS database, and this is also visible to the company's partners as well. And the third tool that the IFS is making available is the GMP check. So this was created to be performed after the travel restrictions are lifted, while the certification audit has not yet been scheduled. So we know that retailers and wholesalers may want to know as soon as possible if their suppliers still comply with important requirements regarding hygiene, product safety, food safety, and GMPs. So it is a one-day unannounced on-site assessment. Therefore, more production sites can be inspected over the same period of time compared to a complete certification audit that usually takes 2 to 3 days. And the result of this check will also be available in the IFS database. And just reminding that, as I said before, these tools do not lead to a certificate extension and will be available just during the COVID-19 pandemic. So let's talk about BRC now. So BRCGS is one of the schemes that is allowing a 6-month extension of the certificate based on a risk assessment. So the sites that are currently certified with a grade C or D cannot have their certificate extended as they are classified as a high risk for BRC. So we can't go over the risk assessment and extend the certificate for sites with currently grade C or D. And also the certificate extension must be done by the certification body that issued the current certificate of the site. So talking a little bit about the risk assessment, the risk assessment is done remotely by an auditor. And some points that will be reviewed during this risk assessment are, for example, the implementation of sites' emergency response plan to COVID-19, internal audits, recent customer complaints, if any changes were made to the operation of the site in response of COVID-19 as well. So those are some points that will be addressed during this risk assessment. And as soon as the site becomes available and accessible, the full on-site audit will need to take place as normal, and the new certificate will be issued. Next slide. So FSSC, for FSSC 22,000, they are having pretty much the same approach as BRC. So they are allowing extension of certificates for 6 months based on a risk assessment done by the certification body to determine if the risk is low or high. So based on the risk, we will extend the certificate. The risk assessment should be conducted by a qualified auditor, and it is done remotely and usually the duration is from 2 to 4 hours. For FSSC, we are currently scheduling and performing risk assessments for companies that have their audits scheduled between April 1st and May 31st. And if your audit is not due until May 31st, we will send you a questionnaire with some, so you can let us know the impacts of COVID-19 pandemic in your operation, and we will go from there.
Okay, so SQF updates. So SQF has followed GFSI right from the beginning. So they've stayed true to the GFSI mandate, and they do not allow for remote audits, but they are extending certificates based on risk assessment for 6 months. Now, the risk assessment is based on risk, and the risk can be assigned as low, medium, and high. So low risk, the extension goes in right away. SQF reviews it and approves the 6 month extension. The extension covers both the recertification date and the certificate. So both are extended. If there is a medium or a high risk, then a further remote activity will happen, and that's a review of current cars. That's a review of the food safety system and how it's still maintained moving forward. Transfers. So any of the transfers, similar to what BRC has said, is they must be extended by the previous CB. And this is because the previous CB owns the certificate, and they're the ones that will be extending that certificate. Surveillance audits. So the surveillance audits that fall within the boundary or fall within this COVID boundary are given a choice of 2 options. So the 2 options, the first one you can look at extending. So extending the surveillance, but realizing that if you're extending your surveillance for 6 months, then your surveillance and your recertification audit have to happen for your certificate to be maintained. And that can happen if you extend it within a very short period of time. So potentially you're looking at a surveillance audit, and then 2 months later or a month later, a recertification audit. The second option is to have a remote activities review. And this remote activities review must be agreed upon by the facility and NSF. And a remote activities review is essentially a review of the key parts of the program. We'll look at, moving through a checklist that identifies certain areas of concern that were based, that put them into surveillance. So that would be a remote activities review. Once the review is completed, it will be reviewed through technical. Technical will then approve or send it back. Any cars or any non-conformances that are generated from the surveillance audit must be closed as well. And then once that's all completed, we will send that off to SQF, and they will essentially take that remote or that surveillance audit out of ReposiTrak. The request will be removed, and then they'll move forward with the recertification in 6 months. So that's the SQF update, and I will pass it on to Carrie Allen now for organic.
Thank you very much, Jeff. Welcome everybody, and thanks for joining the webinar today. For those of you on the webinar, the attendees who might be impacted by some of this, the delays in certification for either organic or some of your product food claim certifications, such as non-GMO or gluten-free, I wanted to spend some time just talking with you a little bit about any changes to your inspection process. But just be aware too that many of the food product claim certifications are actually only a desk audit, don't have an on-site certification. So your certification process may still continue without any impact to your schedule. So as retailers become ready to accept new products, certainly now is the appropriate time to be continuing on with submitting your documentation or your applications with NSF. So first of all, I'll talk about the organic certification. The US NOP and the Canadian organic regulation maintained by the CFIA, both of them have agreed that remote audits or inspections are possible to extend or continue certification. For new facilities, an on-site inspection is required to issue certification for a new site or new certification. If there's going to be an on-site inspection where the site is still operational and where they are accepting inspectors on site, of course, PPE and social distancing must be observed both by the inspector and by everyone on site at the facility. So we are working together with our customers to make sure everybody is aware what type of PPE and agreement about social distancing is needed to continue on with any on-site inspections. For those facilities that are able to have that remote assessment, that would be for renewal certifications, scope extensions, that type of thing, the remote audit is possible. And what does that look like? That would be a desk audit to evaluate your organic system plan, to look at any product addition and formulations, evaluating records associated with your organic system plan. And then if an on-site audit follow-up is required, that would really be based on the risk history of that site that's being renewed for certification. So if a site has a history of complaints or non-conformances that had not been effectively implemented and maintained, that might require a follow-up on-site, even though the certification had been extended or continued based on the desk audit. NSF or QAI may decide that an on-site inspection is necessary to confirm any of the findings or information that was evaluated during the desk audit. So if you have any questions about the ability for your site to have a remote desk audit by QAI inspector, feel free to reach out to your account manager. I know that they're actively contacting customers to request those desk audits in lieu of being on site. So we want to make sure that we're working closely with all of you who are organic certified by QAI to continue on with your certification process. Now, for some of these food product claims certification programs that NSF operates, including the True Source Honey certification, non-GMO certifications, the certified plant-based, gluten-free, and raised without antibiotics, some of these are entirely desk-based and don't require an on-site inspection. So those are continuing on as normal, and activities are not impacted. So that's fine there. But the ones that are affected by the delays in being able to get on site would be gluten-free. Some of those sites do require an on-site audit. So what we're doing is extending certification for those existing sites and then coming back on site for a on-site audit where required. But remote audits can be granted in order to continue that certification. Most non-GMO certifications don't require an on-site inspection, but in the event where one is required, again, we can just delay the on-site and grant an extension for that. True Source Honey on-site audits also will be delayed those that are due in the coming months here in April and May. Those certifications will be extended for about 90 days with the on-site scheduled afterwards. And the same would go for raised without antibiotics. Any of those delays during lockdown or shutdown operations will grant that extension and then go back on site later. But fortunately, many of these programs, a lot of that evaluation can be done at a desk audit with a much shorter on-site visit later on for the verification if that's required. So thank you very much for joining this webinar today, and I will pass it over to Kim Onette to speak about the second party audit solutions.
Thank you, Carrie. Yes, as Carrie mentioned, my name is Kim Onette, and I am over the second party audit part of the audit supply chain food safety audit business. So any audit that's not under the umbrella of GFSI audits, we would be doing those audits. So maybe these are second party, maybe you have a very specific customer who has a specific audit criteria that they are auditing your facility against, or you may be a user of the NSF proprietary audits and for food manufacturing, packaging, or storage and distribution. So when we had the challenges with COVID-19, we saw very quickly that because we were not under the accreditation requirements like the GFSI programs are, that we had an opportunity to provide a solution to customers, to facilities that would restore visibility. Right now, it's very difficult to get, obviously, to get an auditor into a facility or to travel. But we also know that we need to maintain food safety standards. We need to maintain that visibility, because the last thing we would want would be to have a food safety or foodborne illness outbreak during this time. So our remote audit option provides that visibility through agreed upon remote technology. So we would work with the site to agree upon a platform for video conferencing, interviewing employees, interviewing senior management, and then also use a secured document exchange platform. So it's NSF secured, so very specific, where the site would be invited to that platform by the auditor, and then only the auditor and the site have access to that folder for exchange of information. We see these audits being carried out as they have in the past when it was on-site, where we're transforming the presence of the auditor from 3D to a 2D presence. We now know that technology has advanced enough that someone can walk with their iPhone on a FaceTime call, on a WhatsApp video call, on video conferencing technology through an iPad. And the auditor would then guide their audit, the audit facilitator at the site through what they would want to look at, what they would want to watch. Interviews would be taking place most likely in a boardroom or in a conference room because of physical distancing and because there may be sound in the factory that's just a little too loud to be able to hear. And then we also have the option now of time and date stamped photos. So we've been able to utilize technology to get that visibility into a facility without the physical presence of the auditor there. There is a very rigorous technical review that would take place, and the site, if scored properly, if the score indicates, would be able to have an audit report, have some evidence to show their customer that they are maintaining their programs. So because it's a second party audit, we could use a customer's current audit or the NSF supplier assurance audit. In order to identify which sites would be appropriate for this type of audit, there is a risk assessment process that takes place where previous nonconformances, previous performance in audits, previous performance with that customer or with the NSF supplier assurance audits indicated a strong food safety program and the product was of an appropriate risk. So we are beginning to see a lot of interest in this type of audit, and industry recognizes that we need something, again, that would provide that assurance. So if you have second party customers or you have questions about how remote audits would work, please reach out to your key account manager or reach out to our information website, and we're happy to discuss that with you. I would like to now pass this on to Orshi Desi, who will talk about the need for cleaners in food facilities and the challenges we're having with sanitizers and what's acceptable and what isn't.
Thanks, Kim. As we've mentioned a little bit earlier in this presentation, we did a survey for our clients, and just thanks again for all of the responses. But nearly half of the respondents did note that there are supply disruptions, especially with cleaners. And so I've been getting quite a bit of calls about where to source new cleaners from, what to look for. So the first thing that I really want to note is if you're looking at adding a new type of sanitizer or disinfectant to your cleaner repertoire, one of the first things that you should do is absolutely verify that it is registered by the US EPA. So the EPA administers a program fondly known as FIFRA, and any kind of product that makes any type of a kill claim is registered and listed on the FIFRA website. Now, what the EPA has also done, which is really handy and easy, is put together a list of disinfectants that are known to kill COVID that you can access right on their website. So for any kind of disinfectants, if you want to validate the claims, make sure that those disinfectants are indeed doing what they say they do. You want to ensure that it is FIFRA registered with the EPA. What FIFRA or the EPA and FIFRA have done is that they are trying to expedite any new sanitizers that are coming through or disinfectants to get those reviewed a little bit faster than usual for their turnaround times, although they have not become any more lenient in terms of their requirements. Now, on the other side, we have the FDA. So anything that's coming in contact with your skin and making any type of antimicrobial or kill claims is now under the purview of the FDA and is actually considered an over-the-counter drug or an OTC. So what the FDA has done is they've come out with some temporary policies for how to prepare alcohol-based hand sanitizers and for the manufacturing of alcohol. And so what we're noticing is that there's a lot of shifting up from distilleries, breweries, manufacturing, shifting their manufacturing to making alcohol and putting sanitizers, hand sanitizers out in the market. So that temporary guidance provides formulation, specific guidelines, purity of ingredient guidelines, labeling guidelines. So all of that is available. And just, again, another way to verify that something that you're using within your facility actually has gone through sort of regulatory review. And so finally, within NSF, we have the Non-Food Compounds White Book, which is a legacy from the USDA White Book that a lot of people know in the industry. And what we do within that non-food compounds program is evaluate cleaners, disinfectants, any type of chemical compound that's used in food processing and food handling. Want to make sure that if it's used as outlined, that is actually safe to use within those facilities. So one of the things that might be helpful if you're looking for a new source of a new supplier, different type of cleaner, potentially just checking out the nsfwhitebook.org to see who else or what other companies are making disinfectants or cleaners similar to what you're already sourcing if you're having some issues with the supply chain. So just as a take-home point, if you're looking at trying something new in your facility, if you're looking to try it because it's making some sort of a kill claim, just make sure that there's an additional level of validation behind that, either through an EPA, FIFRA registration, or that it's somehow gone through some sort of FDA approvals.
Okay, thank you, Orshi. So we have time for questions. So I have been reviewing them and organizing the questions. So I'm going to start with the first question for Paul, because this question is focused on employee monitoring of employee temperatures. And how easy is that to do? And what do we do if an employee has a temperature when they arrive at the door, or they in the middle of the shift report that they aren't feeling well? It makes sense that this would be a little bit challenging in that if you've got a shift of 50 people, that's a lot of temperatures.
Okay, it is challenging. First of all, there are touchless temperature monitoring devices that are recommended to be used. Second of all, you want to screen or take the temperatures before the employees enter the facility. That way you're reducing the risk of infection. And I guess the third is if an employee does exhibit symptoms or feels sick during their shift, you should already have a designated isolation room, a room that's separate, a room that ideally has a self-closing door or a closing door. If it's vented, so there's a window, that's even better. And if it has easy access to the exit. So again, what you want to do is you want to minimize any potential that the employee will have will be infecting other services or other people. And yeah, frankly, Kim, it's tough. It's one reason why it's one of those difficult yet aggressive things that that a company needs to really make an investment in and say, listen, am I going to be aggressive or am I not going to be aggressive? And it's an aggressive measure. What I will say is that some companies have chosen not to take temperatures. And they've done that because, first of all, a fever isn't a symptom in 100% of positive cases. Depending on what you look at, it could be anywhere between 60 and 70%. And also, it doesn't necessarily capture someone who's asymptomatic or pre-symptomatic. From my perspective, I view it as one of the hurdles. So if you are wearing the masks, if you are separating, if you're doing everything else, and in addition to that, you are also taking temperatures, then you're just doing that little bit more to protect your employees, to be seen that you're protecting them, and to reduce your risk.
Okay, thank you. Thanks, Paul. Sorry to keep you on the spot, but I am going to keep you on the hot seat. So the next question, so I have two questions. What about transfer of the virus on cardboard? Have you heard any evidence of that, or can you speak to what we've been hearing about the virus survives on a surface for a certain amount of time, and maybe some of us on the call feeling like once we get home from the grocery store, we need to wipe down the outside of every container and things like that, which, you know, extra precautions are never bad. But could you speak to that a little bit?
Sure. So I think it was about 3 or 4 weeks ago, the New England Journal of Medicine did publish a report that showed the, I guess, the length that the virus could survive on different surfaces. Cardboard being not long, basically. And I can't remember the exact number of days or hours or what it was, but definitely not, it wasn't that long. However, there's still a theoretical risk, and and then you use a takeout or the groceries, for example. Yeah, so in theory, if the container were to be contaminated, takeout or otherwise, and then brought home, then it could contaminate a surface, contaminate hands, somebody could get sick. But to date, there have actually been there's been no evidence of anybody getting sick this route. So the risk remains theoretical. There are recommendations there out there for consumers to wipe their groceries down with disinfectant wipe prior to them, putting them away in the refrigerator. At the same time, and this is one other reason why I love my kids. Because on TikTok there was a video that was out of somebody offering really good advice, saying, "Hey, when you get your groceries and produce home, wash your produce with soap and water." And there's an image of somebody washing a cucumber in a sink with soap and water. So there's some bad advice out there as well, and there are people taking the risk a little too far and actually introducing new risks inadvertently. So if you were to ask me what I do and what I see I guess most people doing, which seems reasonable, is when you bring groceries home, then wash your hands really well and wash the surface that you may have rested. If you put them down on a table, for example, you're going to want to wash the table. And then if you are more risk averse, then you might want to wipe them down with a disinfectant wipe. And if you're not risk averse, then don't.
Fair enough. Fair enough. The next question is about, is there a UK or EU equivalent on the N95 masks, or can you speak to those specifications around the N95 masks? Paul.
Kim, okay.
Yeah, sorry. Or she may have a view into this also.
One reason why I love working, one of the many reasons why I love working for NSF is that when clients or anybody asks me a question that I can't answer around masks, I know exactly who to send them to. So we do have somebody in our medical devices team, Kim, who you may know, who would be able to answer that question very, very easily. I'm not sure if Orshi can answer it though.
No, sorry guys, I'm really with the
Okay.
seconds, but agreed, Paul. We have an entire health sciences division that we can absolutely bounce this off of, and they would have a great answer.
Yes, totally agree. We can work on that and follow up. We have the originators of the questions, so we can follow up with that. We have time for one more question, and it's something that I think will be getting more more discussion as we move forward through this crisis, and we have challenges with traveling auditors, with getting audits done, and it's around remote audits. How many have actually happened, and how useful would they be? Right now, a lot of sites are very nervous about pulling resources away from the manufacturing process because they are producing under stress. And I think ultimately we're going to see that balance out where there will need to be and some type of activity to maintain that visibility and confidence in the supply chain. And I think this is an evolving, it's an evolving subject matter. And probably will depend on each site and their customer base and what they need to do. So no definitive answer around numbers. We are in early days. Based on the risk level of a site, there will be a role for some type of remote auditing activity, certainly under the second party banner, so outside of accreditation. So I appreciate those concerns. And we're seeing really kind of a push-pull situation evolving with that. So points very well taken in that question. I want to thank everyone for joining us on this webinar. You see the email address on the screen, foodsafetysolutions@nsf.org. Please email that inbox if you have questions for any of the presenters, if you have questions about our services or questions in general. We are here to help. We want to be a partner during this difficult time, and we're happy to answer questions you might have. Thank you very much for attending.